We had two waves, as a matter of fact. We had one on Friday afternoon of the magnitude of 7.7, and then we had the second one on Saturday afternoon with the magnitude of 5.5. I'm based here in Nyapitao. Nyapitao is one of the locations that have been affected by this earthquake. Uh, the hospitals are overwhelmed. People are living outside the buildings because they're scared. We have, as shocking of considering that this is a city, issue related to lack of food, water. Food and water are coming intermittently. It's very difficult to communicate. As a matter of fact, we are using, as I speak to you, my iPhone hotspot in order to be connected with you right now. Internet has also been disrupted, which does not help the work that we're trying to set up. Over the last 48 hours, we have been, all of us collectively, from UN agencies to local and international NGOs, we have been organizing the response. Everybody is sending supplies, from food to health supplies, to the affected locations. Roads have slowly been resumed in terms of functionality, but there are still serious issues to reach locations on the way to Mandalay, for example. As I said, from the World Health Organization point of view, several hospitals have been damaged here. A few have collapsed. Emergency rooms are filled up with patients. We have already transported in the first 24 hours since we started the response 3 tons of trauma kits and other essential health kits from Yangon City to Nyapitao, but also we sent one truck to Mandalay. As we speak right now, together with our health in emergency program in Geneva and our regional office, Seattle, in India, we are organizing another humanitarian cargo for almost $1 million supplies, which will depart from Dubai hub and will reach Yangon. And then from Yangon, we will organize the distribution of these additional surgical kits. Right now, it's very much critical to have trauma surgical kits because there are lots of people who are wounded. Me, myself, I had the opportunity yesterday to visit a hospital that has been damaged at 70%. Radiology department is no longer functioning. You have patients laying on the floor because there is also a lack of beds. Some rescue and emergency medical teams have arrived in the first 48 hours. However, several buildings have collapsed. We know that we are still missing more than 200 people who are still stuck under those buildings. So we still need more rescue capacity, but also we need more emergency medical teams to make sure that people who get extracted can receive the trauma care that they need, sorry. On the other side also, we are approaching the hot season here. Today, as we speak, it's almost 35 degrees Celsius degrees. There is shortage of water. We fear that this could lead to possible outbreaks of cholera. Mandalay, which is one of the most affected areas of this earthquake, already last year had an outbreak of cholera. As a matter of fact, the outbreak of cholera impacted almost 50% of the townships in Mandalay. So we as WHO, we remain concerned about three things. Number one, continue bringing the critical supplies for trauma care. Number two, making sure that we can continue our work for prevention of water-related diseases like cholera. Number three, to avoid the further disruption of the essential care, the essential capacity of these hospitals. Several hospitals don't even have X-ray machines anymore. They don't have ECG machines anymore. So this is the reason why we are making sure that besides the medical supplies, we are also bringing some medical equipments that are not easy right now to find locally, not because they were not here before, but simply because they've been severely damaged with shock waves on Friday and Saturday.